name's Carly and I'm the Wandsworth Youth Health Jury facilitator.
Hi, my name is Elisa. I'm in the health jury because I'd like to break down the barrier between doctor and youth.
Hi, I'm Imogen. When I'm older I'd like to be a doctor, so joining the youth jury was a good way for me to experience medicine from a more political side rather than just from a doctor side.
My name is Ishak and I've joined the Wandsworth Health Jury about a year ago, and basically I want to improve the relationship between the young people and the people who are funding the services for young people. Yes.
Hi, I'm Michael. I joined the health jury because I noticed that lots of health services are not used by young people, and I think we should do more to promote those services.
Hi, I'm Anissa and I'm an aspiring medic. I'm part of the health jury because I feel I have an opinion on the NHS and how it could be improved for young people. I'd like to remove any barriers between young people and healthcare professionals that they look up to, such as GPs.
My name's Sangeeta and I joined the health jury to be part of a team of young people that help to improve services in the borough of Wandsworth.
Oi, oi! Yeah! Hi, I'm Sophia. The reason I joined the health jury was because I wanted to make a difference. And the thing I want to do in the future is I want to remove new stereotypes that have been put upon people.
I'm Selena. I joined the health jury to have my say about the NHS and work together with young people to make a change and hopefully see the difference in the future.
Hi, I'm Michelle and I really want to make sure young people's voices are heard so that adults really use their opinions and make health services appropriate for them.
I'm here to talk about my experiences with the NHS services. My best experience with the NHS service, the time I went to the GP for a really bad burn on my chin. The lady was really nice and the reception worked very fast. All she did was prescribe me some simple moisturiser and it healed up within a week.
My name's Sangeeta. I've recently graduated in diagnostic radiography, so I've had the aspect of working both with patients and in the NHS and being a patient in Wandsworth. What I found is that I don't like going to the GP quite a lot. Reasons for that might just be nervousness really, and maybe because I expect too much.
Come in. Okay, what's wrong with you?
My ex has flared out recently. It's quite bad. It's really painful.
Yeah, it is really bad, isn't it? Ooh, have you been putting on your cream?
Yeah, but it's not really working anymore.
So it's your fault then?
When I was working in the hospital, there'd be a special kind of treatment that I would give to patients, and looking at it on the other side of the coin, I would expect that treatment to be given back just as good. When I went to the GP, he was unsure about what it could be, whether I was allergic to something or whether I wasn't. So he told me to Google my symptoms. Now Google is a very wonderful creation, but when that regards my health and when I go to a GP, I don't expect to be told to Google my symptoms.
What do you want me to do then?
Isn't there something else you can give me? You're meant to be the doctor.
No, maybe Google it.
Google it? You want me to Google it?
Yes, I want you to Google it.
But you're meant to be a doctor.
And you're meant to put on the cream.
This is wasting my time. I'm going to come back and find another doctor to see.
Hello, my name is Shahir and I've been at the health jury for about 2 years now, and basically why I joined was to get an experience of the administrative style of healthcare. I've been doing some research lately about young people's opinions on healthcare. I found some interesting statistics as well. And I've generally found out that young people like to be treated like young adults rather than children, and they like to be treated with respect and dignity.
My long-term condition, polycystic ovary syndrome, I'm not sure whether or not a lot of teenagers get it. It's basically where your ovaries are too large and you get a hormonal imbalance. The staff in the NHS are usually generally friendly.
Come in. Hi, I'm Dr. Melissa. How are you today?
I'm good, but my eczema's flared up really recently.
Oh, okay, let me take a look at it. Is it painful?
Yeah, and really itchy.
Okay, right.
I usually go into the hospital a lot to get screened, to get tested and to get treated. It's not entirely comfortable to go inside a hospital to talk to a GP or to get screened or something. But other than that, it's not too bad. You usually get treated well.
We'll review it in about 2 weeks, and you can tell me if it's feeling better or if it's still painful. All right, so take a look at that.
Thank you.
Okay, take care. Bye-bye.
Bye.
We're at Infuse Cafe at St Mark's Church to talk to young people about their experiences at the NHS.
They do tend to group us all saying, oh, they're all, they've all got STDs and whatever, when actually that's not true. But I think there's much more awareness now about that than there was before.
I personally wouldn't know where to go if I did need advice with anything. But I know they do exist, but I wouldn't know where. It's not clear as to where they are.
I'd prefer to have a younger GP.
I think I'm treated like a teenager.
Yeah. What one change would you make to the NHS to make it better for young people?
Well, understand us better, innit?
Yeah? How do you think they could do that?
I don't know, treat us like we're individuals, like adults.
I think it's a little wrong because not all of us are bad. I think they're just videoing the bad ones, and it gives an impression that we're all bad. Not all of us go out binge drinking and smoking. So I feel they need to speak to all of us, not just the bad ones.
And basically, the vision for this white paper is to describe the way that the NHS will work, or could potentially work in the future. And so it describes a system where patients are at the heart of everything that the NHS does.
I think that's good. It's kind of like market research in a way, because it's kind of getting people's opinions on specific things within the NHS to help them develop it more. So I think that's a good thing.
Yeah, I think it's good because it just lets them know exactly what we want, and if the service is for us, then surely we should have a say and get them to give us exactly what we need from the service.
The Monitor and the Care Quality Commission, they'll be regulating the kind of finances and the quality of services, and at the moment PCTs do that. So it's quite a shift.
I think that's really unfair.
Yeah.
I know obviously it saves a lot of money by kicking all of you out, but that even though the NHS is doing positive things, if you see them kick out that many people, you're still going to complain about the NHS because you're thinking, personally I'd rather have my taxes upped by, I don't know how much, but up to at least a little bit, so that look how many people are going to lose their jobs. We just see one floor and that's so many people. I think that's a joke.
Either way, the same jobs need to be done. So what is the point in abolishing the PCT when these different groups are going to do the same thing? So why not put all that money into just keeping the PCT alive?
Restructuring.
Yeah. Because either way, maybe you can develop the PCT more to make it more cut the budget somehow within the PCT instead of thinking of a new reform to make things supposedly better, when either way your aims and objectives are going to be the same.